case anybody wants to look at it for the public. And I do have a copy of the notice for this meeting. And with that, we'll have roll call.
Here.
Festerson.
Here.
McNally.
Here.
Rogers.
Here.
Weiss. Yes. Jones. Wilkin.
Here.
King. Espinoza.
Okay, we'll go to item 2, which is the approval of the minutes for the June meeting. Is there a motion to approve? There's a motion by Ways, a second. Second by Weiss. Roll call.
Wilkin. Yes. Wade.
Yes.
Rogers.
Yes.
King. Jones. Weiss. Yes. McNally.
Abstain.
We'll go to item 3, which is approval of action items that,
We weren't quite finished.
okay.
Espinoza and Festerson.
Yes.
We can just go with who's on record, though, for the future. Item 3 is approval of the action items. We have 3 items. Is there a motion to approve the action items?
So moved.
Motion by Weiss, there, second.
Second.
Second by Wilkin. Roll call.
Festerson.
Yes.
McNally.
Yes.
Rogers.
Yes.
Wilkin. Yes. Weiss.
Yes.
Wade.
Oh, sorry. Yes.
Okay. Item 4 is the presentations. We can go to letter A, which is acknowledgements of the Westview YMCA leadership and commitment to public health.
Good morning, board.
Good morning.
We today kind of marks a significant milestone as we present our first challenge coins and resolutions to several esteemed community partners and individuals. These coins symbolize our deep appreciation for their exceptional contributions to public health. Just so you know, historically, these challenge coins have been presented by military unit commanders and have awarded challenge coins to those who are recognized for extraordinary achievements. And this tradition has grown to include CDC, Public Health Service, and now us. I thought it was really important that we recognize those that have gone above and beyond in our community, our partners. And so I'm proud to carry forward this tradition by acknowledging our honorees today for their outstanding dedication and service to public health. So I will invite those from the Westview YMCA, Rebecca Detterding, who's the president and CEO, and Tara Thomas, who's the vice president of advancement. If you guys just want to stand here with me for a second, and I'm going to read this resolution, and then Dr. Hughes will present a signed copy of the resolution and a coin. So this resolution is honoring the Westview YMCA for their exemplary assistance in the tuberculosis investigation. Whereas the Westview YMCA has provided essential support in the epidemiologic investigation of a tuberculosis exposure. Whereas their assistance included providing crucial information, offering an on-site location for the testing clinic, and responding rapidly to public health requests. Whereas the Westview YMCA has demonstrated outstanding partnership and collaboration with public health authorities. Whereas with understanding of the importance of public health initiatives has been vital in ensuring the health and safety of our community. Now, therefore, it is resolved that we extend our deepest gratitude and highest recognition to the Westview YMCA for their exceptional support and commitment to public health. Be it further resolved that we acknowledge and appreciate their role as great partners in this critical public health effort. So if you want to go up. Emily, do you want to come back up? So this resolution is honoring Emily McCutcheon for her exemplary service in coordinating the laboratory response to the tuberculosis exposure, which before I read this, I have to say thank you. And we could not have had the response that we did without Emily and her assistance with the Nebraska Public Health Lab. So, whereas Emily McCutcheon, manager of the Nebraska Public Health Laboratory, has demonstrated exceptional dedication and expertise in coordinating the laboratory response to a large tuberculosis exposure and investigation, whereas her efforts were instrumental in enabling public health authorities to test over 400 exposed individuals, thereby ensuring prompt and effective response to the exposure. Whereas Emily's commitment to public health and its mission has been evident in her ability to seamlessly integrate laboratory operations with public health practices. Whereas her leadership and coordination significantly contributed to the successful management and containment of the tuberculosis exposure. Now, therefore, be it resolved that we extend our deepest gratitude and highest recognition to Emily McCutcheon for her outstanding service and unwavering commitment to public health. Be it further resolved that we acknowledge and appreciate the critical role she played in protecting the health and safety of the community. Thanks, Emily. Go. Dr. Neiman and Megan Conley, do you guys want to come up? So again, huge thanks to Dr. Neiman for coordinating the response at Children's Hospital and for all of the leadership, including Megan's. And so this resolution is honoring Dr. Neiman for her exceptional contributions to public health and Children's Nebraska during the tuberculosis response. So, whereas Dr. Neiman has demonstrated outstanding dedication and expertise in the field of public health, particularly in her role as the Douglas County Health Department Medical Advisor. Whereas Dr. Neiman's leadership and commitment was instrumental in managing the large tuberculosis exposure, ensuring the health and safety of all affected individuals. Whereas Dr. Neiman collaborated closely with the infectious disease team at Children's Nebraska, showcasing exceptional teamwork and coordination. Whereas her efforts have significantly contributed to the containment and management of tuberculosis exposure, preventing further spread and ensuring effective preventative treatment for those affected. Whereas Children's Nebraska has long-standing commitment to public health and the well-being of children and families, providing exemplary leadership and resources in times of public health crises. Whereas the leadership of Children's Nebraska, including its infectious disease team and administrative staff, played a crucial role in supporting Dr. Neiman's efforts, ensuring a coordinated and effective response to the tuberculosis exposure. Now, therefore, be it resolved that we extend our deepest gratitude and highest recognition to Dr. Kari Neiman and her exceptional service of unwavering commitment and public health and the well-being of children and families served by Children's Nebraska. Be it further resolved that we acknowledge and appreciate the collective efforts and exemplary leadership of Children's Nebraska and all involved parties whose support and collaboration were crucial in navigating this public health challenge. Thank you both. Thanks. And we have one more, so if Dr. Matt Donahue would come up and stand with me. I just want to say how sad I am to see Dr. Donahue leaving Nebraska and going to Iowa to be their state epi. He has been a force of public health to not be reckoned with, and he's a great friend of mine. So this resolution is recognizing the exceptional contributions of our state epidemiologist, Dr. Matthew Donahue. Whereas the health and well-being of the residents of Nebraska and Douglas County are paramount importance, and whereas the public health epidemiologist has demonstrated unwavering dedication, unparalleled expertise, and exemplary leadership in safeguarding our communities And whereas through his visionary approach and profound knowledge, he has effectively guided us through numerous public health challenges, ensuring safety and health of our residents. And whereas his commitment to public health extends beyond his professional duties, embodying a true sense of service, compassion, and excellence. And whereas his tireless efforts, innovative strategies, and collaborative spirit have significantly enhanced our public health infrastructure and emergency preparedness, and whereas his work has not only protected the immediate health of our community, but has also laid a strong foundation for the future of public health initiatives and resilience. Now, therefore, be it resolved by the leadership of the Douglas County Health Department and the Douglas County Board of Health that we extend our deepest gratitude and highest recognition to our state epidemiologist for his extraordinary contributions to public health. Be it further resolved that a copy of this resolution be presented to our state epidemiologist as a token of our appreciation and esteem. Thanks, Matt.
Thank you so much.
Yeah.
Come on, guys. Thank you, guys.
Need a wider lens.
Stay. Do you guys mind?
No,
if I
he's
say
covered now,
a
so.
couple words?
No, you go ahead.
I won't take up too much time, I promise. That was too kind not to say a little thank you for. And I got a few notes here too. It's a tremendous honor to receive this from you guys. Thank you so much for this. Over the past 5 years in Nebraska, through nearly every type of emergency and manageable, we've worked hand in hand with local health departments, and especially Douglas County Health Department. It's truly been a highlight of my career, and thank you so much for all the collaboration and work. What we've been able to do together to help prevent unneeded deaths, to help prevent unneeded suffering, it really stands out as some of the most rewarding work I've ever done. From Ebola preparations and traveler monitoring, to repatriated Americans, to Diamond Princess, to all the COVID work from beginning to end, to Mpox vaccinations, to an environmental Naegleria fowleri amoeba investigation, to helping children exposed to TB like we talked about this morning, to eliminating a novel rabies strain from our state, to battling record-breaking syphilis rates. I want to say, although we're not the most visible always, we don't shout it from the rooftops, but this work has really counted for something. This work has counted for a lot. Nebraskans are safer and are healthier because you guys keep showing up. Time and time again into every new emergency, you keep showing up, and you all keep showing up with your competence and skill and willingness to get to work, and with a clear focus on the mission, helping people and saving lives, which has made our collaboration really, really easy and really rewarding. So thank you very much for this coin. You don't know what it means to me, but also thank you for what you do and for doing it so well and for doing it with the state. Thank you for putting some trust in a new guy who just arrived from CDC in 2019. And thank you for stepping up. Thank you for staying late. Thank you for the friendship. And lastly, on behalf of myself and all of your residents, thank you for the critically important work that you do and for doing it so well. Thank you, guys.
So before we move on behalf of the board, to all of you that received recognition, again, thank you for your efforts. Sometimes unrecognizable efforts. Unfortunately, there will be more, but it's good to know that you appreciate it and that we'll be prepared for the next time. I'll say to Dr. Donahue, even though I haven't had to work directly with you, but even during the period, I will say through all the philosophical differences from the people that I talked to, particularly I'll vouch for Dr. Maureen Tierney. Everybody spoke very highly of you maintaining your professional ethic in the whole environment and how it went on. So I wish you well in Iowa, and thank you for everything, particularly during the pandemic. Appreciate it. With that, we're going to item E and the PRC vaccine hesitation survey. Okay.
I apologize, my video stopped. Okay. I don't know if they're on, I can't find them. Let's see, they are online. They should be. But I do not see them. So,
We can go to
can we
budget if
skip
need to.
and then come back to
Yeah,
them towards the
sure.
end? Awesome.
Move to item F, and Jerry, if you ready with the budget.
Sorry about that. And thanks for allowing us to do the coins and the resolutions this morning. So today I'm supposed to give my division update, and as you know, I've almost been the deputy health director for a year now.
You doing
Which
the
is-
budget or you doing your division?
We're doing, well, the budget is part of my division.
Okay, I'm thinking, okay, got it.
Yeah. And but quickly, I just wanted to highlight a couple really high level, 10,000 foot things that we've been able to achieve in the division. Then I'm going to turn it over to Jerry, Chad, and Noel to all kind of give you some specifics. Like I said, been the deputy director for almost a year now. So prior to that, we did not have a deputy health director. So we've been working through what that means for our department. Dr. Hughes and I have started really defining our roles and responsibilities better now that we kind of have a feel for what it's like. We've also been working on some vision to reality, setting the vision for the health department, and Dr. Hughes is going to talk more about that later. Hopefully we have time. We've been also working on identifying opportunities in the community, funding, potential foundation, et cetera. So working a lot together on that. And obviously working on the daily operations based on contracts and policies. We've been able to wrap up the FY24 budget, which Jerry's going to talk about. And we've successfully set the budget for the fiscal year 2025. We've been talking a lot about the building improvements. We've added cameras and 24-hour monitoring. We're adding additional strike pads for additional security throughout the building. We're adding a sound mitigation system for the lower level. If you've toured the building, we have a lot of our employees and our team members down there. Hopefully that will help. Doing some repairs in the back parking lot. And the one that I'm most excited about is we're actually going to be remodeling the conference room that you were all in last month. We're going to be adding nearly 170 square feet to that room and are putting some significant resources into the technology. So hopefully making it a space that the entire department can utilize more and bring more of our community partners to the health department and not constantly having to be looking for space in the community. Last month, the Emergency Preparedness Program, which is under my division, spoke to you about the Community Reception Center that we're working on. So a lot of work has gone into that last year in purchasing all of the radiation detection equipment we needed because we had some funding, so that was our focus. But we're moving forward with planning. As you've heard lots about, we had the large rabies response, the TB response, which led right into the tornado response, flood response. So it just seems like response as we continue to move forward with emergency preparedness. We're also continuing to plan for points of dispensing, or pods. So that would be like where we're giving out antibiotics or vaccines and things. So it's probably one of the more likely things we'll be doing. So we're identifying staff and starting to train those individuals about what their role would be should we have to stand up a pod. Last year, we ran into some issues with funding for emergencies. So this year, in working with the finance office and Jerry, we were able to put $500,000 in spending authority for public health emergency. So hopefully that'll kind of be some seed money to get us moving, and later, if CDC or other federal agencies give us dollars. We've also applied for a $5 million emergency fund grant through CDC, which is not awarded unless you have an emergency, but we're waiting back to hear if our application has been accepted. Today, Chad Wetzel from the Communicable Disease Epidemiology Office is going to talk to you, but obviously lots of response work there. But the big news is we moved our data analysts from Vital Statistics to the Communicable Disease Epi Office. These two individuals are still department data analysts, but what we're really hoping to do is start working on some major data modernization and moving all of our data health indicators that we have to a dashboard like to a dashboard. So it'd be very much like the COVID and the influenza, and we also have some environmental dashboards up there with air quality and things. And then lead prevention. Noelle's here. She's going to talk more about the lead prevention program, but really excited on an extensive campaign that they're putting together and some advertising to continue to increase the number of blood lead level screenings. So with that, I'm going to turn it over to Jerry, Chad, and Noelle. And then if you have questions, we'll be happy to answer those at the end.
Where did you say this was? Okay, so how do I just full screen? What you're gonna do is you're gonna go up and we need to share the screen down here. Share. Okay, and then click on it. Okay, and then share. Okay. Go ahead and increase it. Okay, how do I get rid of this stuff? Pick it up and drag it up in it. Okay, so how do I get rid of that? Or do I? You don't.
Okay, good morning. So I'm just going to do a year-end review of our FY24 budget that ended in June. All of you received this report in your packet, which is where we left at the end of the year. As you can see at the bottom of the screen there, our total budget for the year was $21.2 million, roughly. And of that, we spent 74% if you look at the total. And that's total is including county and grants. So that is kind of skewed because grants begin and end at different points through the year. So if we really want to get a full picture of where we're at for just the fiscal year, we'd want to look at the county piece, which is right here. And we spent 92% of our total county budget, which was $7.5 million. To give you some highlights, you go back up here to the top, which is the roll-ups for each department, and you can kind of see where we were underspent in some areas and overspent in others. And you'll see we were way overspent in business section right here, and that is due to what we do call the year-end spend. So we look at where we're underspent and use those dollars to cover projects that we want to do throughout that we weren't able to cover throughout the year, weren't budgeted for, and we're trying to get done. So, and some of those items, as Justin mentioned, were a few, but like the conference room remodel and upgrade. We've also planned to add a permit window down in the food safety and compliance area, so that way the inspectors do not have to go out into the hallway or front area. They can come right up to the area and discuss privately with them what's going on. We are adding new key fob entry for the medical supplies within the clinic area. We're doing a phase 3 of computer replacement project, and then some of the funds are going to be used to license and insure the new drone that we purchased. The other thing is, as Justin mentioned, that we did finish and submit our budget for next year, and that including grants and county, we have a budget of 22.9 million. And of that, the county portion is 7.6 million. And that's all I have.
Any questions? Okay.
All right, thank you.
Yeah, did they? I just have to click here. Well, thank you and good morning. Again, my name is Chad Wetzel. I supervise our communicable disease epidemiology section. I'll be providing some updates, general updates of our program, and also discussing some of the work that we've been doing this year, and also discussing some of the common reportable diseases that are currently circulating in our community. Justin talked a little bit about this, but I did briefly want to share with you some staff updates. So, due to several resignations over the past year, 2 new disease investigators and 2 new epidemiologists were recently hired, and a new public health nurse for the tuberculosis control program will start in a few weeks. This will actually be once that nurse starts, it'll actually be the first time we're fully staffed in about 2 years. So I'm kind of excited about that. We also had, like Justin said, had 2 data analysts join our section that were transferred from Vital Statistics, and having them at the Midtown campus, again, helps them work closer with more of the health department staff and also provides more data support for the department. The data analysts will be integral in our department's data modernization efforts as our department transitions to better methods of sharing and visualizing our public health data. Moving on to respiratory diseases. Our respiratory diseases typically circulate at a low level over the summer months, but we still monitor activity through that time. The past season, COVID-19 activity peaked in December and slowly declined throughout the rest of the respiratory season. The number of positive COVID-19 tests and percent positivity somewhat increased in June, though. However, overall COVID-19 activity and hospitalizations due to COVID-19 still remain low compared to activity seen this past winter. On June 27th, so just recently, the CDC director adopted the ACIP's recommendations for the use of the 2024-2025 COVID-19 vaccines in people ages 6 months and older. These vaccines are expected to be available in the fall of this year. The newest vaccines will protect against the JN strains, which are a descendant of the Omicron variant. The newest variants that are circulating and causing infections now are known as the KP variants, but upcoming vaccines are still expected to provide protection against these recent variants. Okay, regarding influenza and RSV, this year's influenza season peaked later this year. So as you guys remember, we had all 3 we had COVID-19, influenza, and RSV all peak very similar times last year, the season before. So it did put a lot of burden on the community. A lot of individuals were sick and had to be tested to ensure what kind of respiratory virus they were actually infected with. This year was slightly different. We did have a peak later this year for influenza. Activity was highest in February and March of this year. However, the total number of cases reported this scene overall was similar to last year. Current influenza activity now is very low. The CDC recommends everyone 6 months of age and older, with rare exceptions, to receive an updated 2024-25 flu vaccine to reduce the risk of influenza and its potential serious complications this fall and winter. And it is again expected to be available this fall. Our epidemiologists are working on making further improvements on our public dashboard for influenza as we head into the 2024-25 season. RSV activity peaked earlier than influenza this year in November and December. Several RSV outbreaks were identified in long-term care centers, and currently RSV activity is low. There are some updates to the RSV vaccinations this year. They've actually recommended now that anybody older than 75 years of age is recommended to receive a single dose of RSV vaccine, and adults 60 to 74 if they are at high risk. CDC also encourages recommending the RSV immunization to protect all babies from severe RSV, including the antibody that is available for babies and some young children to protect them from severe RSV, and also the RSV maternal vaccine is also available for pregnant mothers at weeks 32 to 36 weeks of pregnancy to pass on protection to their baby. Moving on to enteric diseases. This time of year is when we typically see increases in our enteric or gastrointestinal diseases. They are much more commonly reported in the summer and fall. There are several contributing factors for this. Higher outdoor temperatures create more suitable environments for these pathogens. And summer activities such as traveling, outdoor cookouts, and water activities contribute to the increased risk for these infections, and we frequently get those reported in our disease investigations. The typical seasonal trend continued this year, and we have seen higher number of enteric diseases reported in June. We have our disease investigators and epidemiologists closely monitor these cases for similar exposures to quickly identify any outbreaks, as well as for individuals working in high-risk settings such as food handling and childcare that can more likely contribute to further transmission. On tuberculosis, so tuberculosis control program is housed in the epidemiology section. Our public health nurses are primarily responsible for that TB program. It involves the identification of individuals with active TB disease and ensures completion of treatment, and it also involves testing and screening of close contacts and others in the community that are high risk for TB. Last year, I wanted to note, last year we had 21 cases of active tuberculosis in our community. That is the highest number of active cases reported in Douglas County in over 10 years. That trend seems to be continuing with 12 already reported through June. 8 of the 12 were pulmonary, and to ensure adherence to treatment, our staff has conducted over 1,500 DOTs since the beginning of the year. I will note over 2024 contact investigations identified 41 close contacts so far this year. 27 of them have completed testing and screening. 15 were determined to have latent tuberculosis infection, and 1 was actually determined to have active disease. Other things I wanted to mention was West Nile virus and bat exposure. So with West Nile virus, we typically see in the warmer months of the year. We also see increases in arboviral and tick-borne diseases. The first mosquito pool was actually identified very early this year, about a little over a month early in late June. We typically don't see it in August. So our radar is up for potential West Nile being potentially transmitted in the community. And 1 positive blood donor so far has been positive. Bat exposures, I only mention this because typically we only see it in high numbers of calls in the fall and spring. However, we are still seeing a high number of volume of calls right now. Our staff, their duty is really to do rabies risk assessments with all those individuals and provide post-exposure prophylaxis treatment recommendations for those that had an exposure, and also help with health navigation to support for PEP, as it is sometimes challenging to find a clinic that can administer that. Just touching base a little bit with some of the outbreaks that we've seen. So just so you guys are aware, 2 or more unrelated cases that are epi-linked to each other are typically considered an outbreak for reporting purposes. A total of 3 enteric outbreaks and 21 respiratory outbreaks have been reported in Douglas County so far this year. Of those 3 enterics, we've had 2 norovirus in long-term cares and 1 caused by Shigatoxin E. coli in a daycare center. Most of the respiratory outbreaks this year were reported in long-term care centers, and 12 of those were caused by influenza, 4 for COVID, and 1 due to RSV.
Can you repeat that definition of what an outbreak is again?
For reporting purposes, we consider 2 unrelated cases as an outbreak, as how we count our outbreaks in the community.
Okay. I'm just curious, Justin, I'm just curious, is that like a standard? Because that's the number for some reason I remember during COVID, that the governor used 2 unrelated community cases. Is that a standard, or that's just a number we're doing? I'm just curious, because this is about the 3rd time I've heard that particular 2 unrelated in some way. So I'm just curious for future. Come to the mic. You can come to the mic, though. You need to come to the mic. You need to come to the mic. No problem.
This is what I get from multitasking.
It's more common when you're dealing with like enteric pathogens or preventable diseases where you're looking at two totally unrelated individuals that have the same illness. And today, like Emily, who is here from the Nebraska Public Health Lab, we can actually sequence genetically a lot of these bugs and see if they're related. So there's a lot of science that goes into this, more than just, were they two unrelated people at the same place? But that's typically what kind of tips us off that we might have something going on.
Okay.
Yep.
But it's not necessarily black and white. If we have one measles case, we also consider that an outbreak. So.
Okay.
And I will mention, I know that you guys are very aware with these large public health responses. I just wanted to mention quickly, what the epidemiology staff was involved with this, how we were involved. So the two large public health responses in the fall, the coordinated rabies response and the TB exposure event. For the rabies, our staff was immediately conducted the comprehensive risk assessment for all those individuals that were in contact with that kitten, and provided a risk assessment and provided recommendations for post-exposure prophylaxis for all of them and ensured they started treatment. Staff also provided support for public communications and media inquiries and coordinated closely with local, state, and federal partners throughout the response. For the TB exposure, or the largest TB exposure event at the daycare, our TB nurses conducted an extensive contact investigation for that and played a crucial role in the identification of individuals potentially exposed. Several DCHD staff overall were also utilized for the setup and operation of that clinic, and epidemiologists and TB nurses were responsible for tracking all exposed individuals and their TB testing status using an internal TB database. Information on more than 500 contacts were managed in this database. Our staff also assisted with sending exposure notifications and testing reminders by mail to all exposed individuals so nobody was missed. And then I also mentioned a couple things on preparing for emerging threats. Two of these I wanted to mention because they're in the media right now. So highly pathogenic avian influenza. It's currently an ongoing investigation by the CDC. We've had 12 states with outbreaks in dairy cows, and if you see the map, it's all over right around us. So Nebraska does, the USDA is testing dairy cattle on a regular basis to ensure that it's not in our state and testing any transfers that are coming into the state. However, so far this year, we've had 9 human cases. This was just updated from Colorado, where they had 4 additional ones with poultry exposure. There's no person-to-person transmissions been documented in the U.S. And how the epidemiology staff is involved is any approval for testing with potential exposures. We would be involved with that, and then also monitoring any contacts if we were to actually have a case, any of those close contacts, to make sure there wasn't a person-to-person spread. And last thing was measles. I just wanted to give you an update. They're continuing to have more and more cases throughout the country, 667 cases in 24 jurisdictions as of July 11th. Our epidemiology staff are involved with the approvals of that testing in case we have suspect cases, monitoring of contacts, and also exposure notifications prepared if we were to have a case. Last thing I will mention with data modernization is Justin also mentioned that this is a priority for the health department, but the two things that our epidemiology staff are involved with was the big piece is enhancing public health data systems. So there are several new systems that we use for higher quality data collection, such as our REDCap system, surveillance systems that communicate with health information systems, such as our electronic case reporting, and further access to health information with Sync Health. And then also it'll be improving data sharing with the public, allowing data portals for individuals to go to those websites and access that data easily, and also provide better data visualizations for more and more dashboards for people to see that data, and we can explain and tell that story and that are important public health issues. And those are all of our staff in our section, and I can answer any questions.
Hey, can I ask a related question for you, Lee, so I don't let it get off track? So back to your COVID slide you had, when you talking about, you had some numbers in there on your COVID slide.
Oh, yeah.
I guess my question is so I came from this conference and they was having some conversations. I'm assuming that we're doing the tracking COVID through stormwater stuff, aren't we?
The wastewater?
Yeah, wastewater, sorry. I'm just curious, have you all seen any rise? Because this meeting I was at, they were talking about particularly California and a rise in stormwater, and I don't know if it's you know how you've always heard Nebraska's a late in, late out state, so I'm figuring if it's starting there and it's seeing some rises, what you all may see. Just curious since that you had that COVID number in there.
Yeah,
I'm just curious.
there was a slight increase that correlated with our increasing number of cases in June. So it does correlate fairly well. The thought was that it would give us a little bit of an early indicator. It might be a week or two, but for the most part, it pretty much correlates with testing as well.
Okay.
Yeah.
Any not enough to get an indication of anything, or is it just the nature of the beast now post?
In just to be prepared for increases or surges.
Well, I'm just trying to figure like now. I mean, you know, you all in the reporting are talking about the upcoming vaccine. So are they treating the COVID vaccine like the flu vaccine and trying to predict what's in it and just get ahead of it? And so that's what I mean. I guess the question I'm trying to ask in some regard is, it's up, nothing to be alarmed. It's not a trend. It's just kind of like this is going to be the nature of the beast.
It's a little hard to predict. It does seem from what's been going on the last 2 years, we'll probably have seasonal updates to those vaccines, probably depending on how those variants change as well.
Okay.
The only thing that I would add is that numbers overall are much lower than we saw during the pandemic, and severity of illness and hospitalizations are much lower than we saw during the pandemic. So we're continuing to monitor it just like we do the other respiratory illnesses, but kind of like you said, Chris, it's kind of the nature of the beast right now, where we're doing our best to predict what's going to happen, but right now things are fairly stable and fairly low.
Okay.
Yep.
No, just one. Thank you.
I'm going to invite Noelle up, and she's the last presentation from my division to talk about the lead prevention program.
We have our online person to do their presentation. Why did it do that to me? There we go. And then okay, there you go.
All right, good morning, everyone. Thank you for having me. My name is Noelle Smith. I am a community health educator for the lead poisoning prevention program. I'm filling in for my supervisor, Nadia McCracken, today. She's actually giving a presentation at the NEHA conference. All right, so just as a reminder, these are our main services that we provide. So we're continuing to do conduct blood lead level surveillance, lead education and outreach in the community, as well as lead risk assessments or our lead inspections in homes. And here are our screening and case numbers as of May 2024. So as of May, we've had 7,260 children tested for lead. And out of those children, we have 141 prevalent cases of confirmed blood lead levels. 67 of those were between 3.5 to 5 micrograms per deciliter, 43 between 5 and 9.4, and then 31 at 9.5 or above. And we also have community partners that are doing testing as well. So our WIC partners have done almost 1,400 tests. We've done 71 tests at our own DCHD clinic, and then Nebraska Methodist College has completed 139. All right, so this map here is of Douglas County, and that yellow shaded area is the Omaha Superfund site. So as you can see, those are where most of our cases lie, with the majority of them being in 68111 and 68107, which are in North and South Omaha. So as most of you know, these areas are particularly impacted by several sources of lead, including chipping and peeling paint, contaminated soil, lead in water pipes, lead in spices, as well as other factors. Some of those other factors could include a decreased percentage in homeownership rate, which can make it more difficult for families to live in homes with lead-based paint, as well as get those hazards fixed. So we're always trying to increase our screening efforts of all children under the age of 7. We've been able to use updated state blood lead testing guidelines to increase screening of those who are pregnant by encouraging OBGYNs to conduct testing, working with our WIC offices to ask a risk questionnaire. and completing testing of those who are pregnant or breastfeeding at various community outreach events. And we'd love to see this continue and to improve screening efforts of our pregnant and breastfeeding population. We also complete lunch and learns at clinics, as well as cold visits and education material drop-offs to those clinics. We've not seen as many lunch and learns with clinics this year, so that's why I've really increased the clinic cold visits and education material drop-off so that at least they're still receiving lead information to give to families or maybe posters to hang up in clinics. I'd love to see those numbers increase, so that might mean going back to clinics that we've gone to in the past and re-educating newer staff or maybe clinicians who didn't attend that first time. We've also begun to do daycare cold visits to encourage testing at daycare sites. So we'll go to either at home daycares or facilities, and we'll bring them lead information as well as NDEE's water testing program information, as that's available for all daycares and schools in Douglas County. And we're hoping to increase these to increase awareness, of course, and hopefully complete additional testing, especially before school begins. And then our own DCHD clinic, we've begun to do testing on Tuesdays, 8:30 to 11 a.m. We've screened 71 children and pregnant or breastfeeding moms this year. And it just serves as another avenue for us to continue testing and just increase those numbers. And we also attend outreach events, many of those, and we've begun to screen at those as well because we have the staff to do so now. So some successful events that we've attended this year include the Cinco de Mayo Health Fair. We had a partnered event with the East African Development Association of Nebraska. We're able to provide screening, as well as the Restoring Dignity Community Health Fair. So we have completed 182 inspections, or scheduled 182 inspections this year and completed 142 of those. The highest source of exposure continues to be lead-based paint and lead-based dust, followed by imported spices, soil, and then maybe other cumulative exposure risks. And we categorize our inspections by pre-1978, 3.5 to 4.9, 5 to 9.4, and then 9.5 and above, as well as clearance inspections. And we're seeing our pre-1978 inspections a little bit higher. And that's really good because those are more of our preventative inspections. So we're not going in necessarily, there's a child that has lead poisoning, but a family that wants to make sure it's safe. So that's awesome to be able to prevent another child from being lead poisoned. So we have also conducted 45 home visits this year as a part of our interior lead dust program. During these visits, we provide a free HEPA vacuum. We perform dust wipe testing and provide lead education to families and residents. And again, this is available for those who have had their soil remediated by the City of Omaha or the EPA. In June, the EPA was actually in town to conduct 2 community listening sessions to provide updates regarding the potential changes to cleanup levels, or that threshold, in Omaha. One was held at the Highlander in North Omaha, and the other at the Center for Advanced Manufacturing in South Omaha. We were hoping for a better turnout. There was a storm one day and extreme heat the next, so we didn't see the numbers that we wanted. But at this time, the EPA has not made a decision to change that cleanup level or threshold in the soil. So we're still waiting. Oh, yes, there's our map. So lead in food continues to be a prevalent topic of discussion for our program. We're currently trying to publish results of our testing of spices onto our website. In addition to this, we're also working with DHHS to create a consumer products lead catalog. So this can include things like toys, jewelry, cookware, things that contain lead or maybe have been recalled. And in June, our lead supervisor hosted a meeting with the FDA, Nebraska AgriLab, and DHHS to discuss lead in spices and lead in food. And my supervisor was able to create a lot of awareness to the FDA just regarding what we're finding out in the field. And like I said, she's presenting a lot of those findings at the Environmental Health Association conference today. So in April, we began another advertising campaign to increase awareness once again. It's been doing really well. We've seen an increase in calls, website traffic, as well as digital inquiries about our services. We've seen great impression numbers from our billboards, grocery TVs, bus benches, Meta and YouTube campaigns, as well as mass emails. We've continued to use our fightled.org to so the community is able to send us digital inquiries about different lead topics, or maybe our services as well. And we've received many calls in April and May from our direct mailers that were able to send out. We've scheduled a lot of inspections, a lot of those pre-1978, as well as the vacuum home visits. And the picture here is an example of one of our 6 billboards that we've had up in the area. They're slowly starting to come down, but you might be able to still see a few of them. And we have them put up around North and South Omaha, as well as the Midtown area. And we've had an equal number of, we've had 3 in English and 3 in Spanish. So what does our future look like? We'll continue to work with our community partners to strengthen education about and screening for lead poisoning. The City of Omaha continues to be one of our great partners in spreading awareness and assisting families with our many services. We'll continue to work with universities, DHHS, refugee organizations, community organizations North and South Omaha, and attend many outreach events in Omaha to just increase awareness and aid in our efforts. We hope to continue to work on ordinance recommendations, including things like all pre-1978 rental properties having to be registered. Maybe annual inspections for residences that have lead-based paint hazards, or maybe increase financial penalties for the properties that are in violation. We can just only hope that this would help there be fewer children that are poisoned by lead. Lastly, we're going to continue our targeted media campaign. We have one more push around the end of summer, back to school time. We're really hoping that will increase back to school screening for children and increase awareness for parents. We're also going to be working with OPS very shortly to hold breakfast and learns, where we pass out information to family as parents are doing drop-off in the morning. And that will also just continue to educate about childhood lead poisoning and encourage testing. And thank you. That is all for my updates.
Hey, before you leave, can you go back to your zip code slide?
Yes.
Yeah.
Mm-hmm.
Can somebody explain what's happening in 68152?
681.
Right up above, right next to the yellow Superfund area, where it's like 134.
Yes. Yes. So that also, it's just considered that zip code in particular is not in the Omaha Superfund site, but still in the surrounding area. So there's still.
Right, but I'm like, that number is.
Yeah. I think that's a mistake.
Hi. It's Nadia, actually.
Oh,
I made
hi,
it. That was my fault. That's a typo. It should be a 0.
Okay.
In 68152.
In 68152, that should be a 0.
Oh, okay.
Okay.
All right.
It's a mistake.
Okay.
Sorry about that.
Yes, I was loading the. I had a screening map for screening numbers, and I just forgot to remove that one.
Okay, no problem. That's good. Can I just ask you on your last slide?
Yes.
So, I'm just curious. I know there was a while ago where we were talking, and this was wild. This was like pre-pandemic. They were talking about doing some. Are you all just, as you see the ordinances that need to be kind of looked at again, do you got a set number and you're going at them, or you just going through them, and as you see them come up, you're recommending them to the city council to be updated? I'm just curious on how we going about that.
Yeah, sure. So as far as what I know my supervisor and one of other of our team members are doing, they're kind of right now, it's very in the early stages of looking at what other cities or other counties are doing, and then hopefully recommending that. But right now it's kind of in the research process.
So we don't actually know how many may need to be tweaked or updated. We just kind of researching right now, getting a gauge.
Yes, I believe that we have a few ordinances, but I can't say for sure exactly what those are.
So it's Nadia again. So we actually have one ordinance that is 18-3R, and there's one line in there, not line, but a little paragraph about lead paint. In there, we're looking to tweak that whole thing and put in additional recommendations in there. So there isn't a whole lot of lead in the current ordinance that we have.
Okay.
So we're looking to see, look at other cities to see what they're doing and then revise that entire paragraph and looking to add more.
Okay. So can you, I'm just, so now if you're doing a look based on what others have and what we need, then I assume it'll catch us up, because at one point, I know there was a look going on to just update or tweak based on modern situations that you all were encountering. But that's, I'm assuming that'll get taken up in the same look. Okay.
Yeah.
All right.
Yes.
Okay.
Thanks.
That's all I got.
Yes.
When you do the home visitations,
Mhm.
is the water, has it already been tested for lead?
Yeah, so actually MUD is the one that is surrounding those. So they have a new map now that we're able to look up if there is a leaded service line. We're not doing any water testing, so we'll recommend that families contact MUD and they can give free water test kits if they would like it specifically tested. But also residents are able to see that map and to see if they do have a leaded service line on their property.
And so when you do the home visitation, you indicated that it's primarily lead-based paint and dust. How do you rule out that it's not water?
Yeah, so it's, like I said, it can be those cumulative things. When we see many lead-based paint hazards, we know that's just easiest for the children to get poisoned by. But if there is water, then that's something we're going to include as well in our sources. But usually if it's not a leaded service line on that property, then we're not necessarily going to consider that a source of exposure.
So back to the individual household, if they are in an area where there is lead-lined plumbing, what do you do? What do you say to them to encourage them to further make sure that their water is lead-free?
Yes, then we encourage them to have ask MUD for those water testing kits, and then also practical things that they can do. So either getting a Brita water filter, if they can't do that, flushing your water for just 30 seconds to 2 minutes in the morning allows decreased concentrations of lead in that water. So those are two practical things that we'll recommend to families.
One last question. Do you have any sense of the follow-up of those households who live in those areas where they actually contact MUD?
Yeah, so not necessarily as many of our water testing kits. Once MUD sends those, it's up to that resident to send them back. More so our follow-up will be the testing of the child. So that's kind of where what we're watching is, are they going back for their follow-up tests, and is that level starting to go down, or is it staying elevated? Then that might be something we'll investigate.
And I'll just add really quickly too. So whenever a resident does follow up with MUD and they have a test done at the property, we do receive those results. And so we save those results. MUD follows up with them if the results are higher than the threshold, and they will provide recommendations for mitigation.
Thanks.
Thank you. Hi.
I have a question about the spices. When are spices tested? Is it just when a child has an elevated blood level, or is there any, I don't know if I'd call it preventative testing, where spices, there's visits to grocery stores and ethnic grocery stores to sample spices to see if they are coming in through the grocery supply?
Yes, that's a good question. So right now, we're just typically testing when the child does have an elevated blood lead level, or maybe we're going to an inspection and looking at all those sources. I would say we're not doing that just because our capacity to testing is limited right now through our state, and once in a while, UNO will aid us in testing. So that is something that we would love to be able to do, is get the testing before the spices even reach the consumer. But right now it's testing what families have in their household.
So can I follow up to that though? So not probably using the right terminology, but say for instance, is there a way for manpower, like, okay, when COVID happened, you had the person, you tracked the person back to COVID to some type of source. Is it a way from the spice to track it to a repeated seller, to try to get ahead of that track, something like that?
Yes, we do keep a log of all of our spices, so we're able to see a trend of certain sellers that they're having lots of leaded spices, so that might be something we're not recommending to a family. Yeah.
And we also, as Noel had mentioned, we had a meeting with the FDA. The state agri lab was present, as well as DHHS, to talk about the catalog that we're creating to make that public, all the information from testing spices and other consumer products public. And right now, according to the FDA, they need more data and results in order to make recommendations and put in place regulations regarding spices. Sorry, but right now they say that they have very limited data.
Okay.
That was going to actually be my question was, is that consumer report going to include basically all of the screening that you all do, or is it
As far as I know, I think
over
it
a certain number?
Yeah, I think it would include all of the
Yes.
screening. Yeah.
Okay. And then can you clarify the comment about the EPA with no decision at this point to change the level for the soil?
Nadia, I might let you clarify that.
Sure. So right now they're in the process of looking at the it's a whole process to enact the change, and so they're currently going to revise the plan. They're going to have resampling of the area of certain places here in Omaha in the Superfund site to look at the extent to which cleanup will need to happen in the future. From what I have gathered from their briefings and their last public availability session, they said it's looking to be maybe about 3 years out. They just published a 5-year review of the Omaha lead Superfund site. And in that, it looks as no later than 2027, I want to say, they will have recommendations out. But right now, there's no interim changes currently in place for the Superfund cleanup.
I guess it's a little concerning to me, just the timing and how much impact it has on all these kids living in these areas, and honestly adults too. But so is there a way to tell like what the level is? Because they had changed it from 400 to the 200, right? And so is there like a database where you can look to see
Yes.
what the level of
So our
soil was?
Omaha Lead Registry, that's through the city of Omaha. They have tracked all of those, or at least participating properties. So you're able to see those levels and the number. So if it's been above 400, or even if it's anywhere from 1 to 400, that number will be there. That's free to the public as well.
Thank you.
Thank you.
Thanks, everybody. Just for time's sake, I think PRC is on the line for the next presentation. But we're happy to bring the lead program back, or if you want to schedule a time to come meet with us, we'd be happy to do that as well.
So did this take care of F and G altogether? Is this the budget and administrative services report altogether? It is, okay, all right. Well, point. Let's go back to item F then.
Great. This is Lori Speaks from PRC. I'm just waiting for control so I can share my screen.
You should be able to do it now.
So you should be good now.
I don't see anything to share my screen. Sorry, I'm not sure why.
I think you were on it. When that green button, you were there. If she gave you permission, you're there on your share button.
Yeah. Is the share button at the bottom of your Zoom meeting green?
No, there's no share button.
Okay.
On your screen?
On my screen, there's no share button.
I will pull up the file that she sent me. I apologize, one moment. Having technical difficulties. we go. And I'm going to go ahead and share the screen, Lori, and just let me know when you want it to advance, okay?
Sure. Sorry, I've never had that happen where I only see 3 buttons at the bottom. I'm on a different laptop, so that could be why.
Okay, you're set to go.
Perfect. Thank you so much. I'm Lori Speaks from PRC. I'm the Senior Vice President of Client Success. And today I'm going to talk about the vaccine hesitancy survey that we did for Douglas County Health Department. We did a survey for both provider and community. And on the next slide, you'll see my colleague Katie Owens was not able to join us today, but Katie was instrumental in the research and also the workshops after we did the findings. And so I'll talk through a little bit about what she did for that. PRC is based in Omaha, Nebraska, and we've been working with Douglas County for years on community health needs assessments, and we work across the U.S. for doing CHNAs. When COVID came around, we started doing contact tracing. We worked for the state of Nebraska and also Douglas County specifically on their contact tracing initiatives. After that, we started doing vaccine surveillance for universities across the United States, and then that led to vaccine hesitancy studies. So we are now going to be talking through the findings from that. If you could go to the next slide. So today what I thought, I'm not sure time-wise how we're doing, but I would talk about the survey objectives, a brief overview on the population survey findings, an overview on the provider survey findings, what was the Community Care Council that Douglas County hosted, what the key takeaways for that that came out of that were, the objectives from that, and then some resources available for this meeting, post-meeting. And then the next slide. So for survey objectives, we wanted to determine the vaccine perceptions and behaviors of both Douglas County residents and Douglas County providers. Some of the topics that were explored in the survey were around trust in sources of vaccine information. We asked specifically about influenza vaccine, COVID-19, childhood vaccinations, and HPV, and surveyed all of Douglas County, broke it up into the regions here you can see on the slide. And the next slide, please. For the project goal, we really wanted to understand the root causes of vaccine hesitancy via the surveyed perceptions of the population and the providers. When you look at the numbers for the residents of Douglas County, we had 848 completions with a plus minus of 3.5% overall confidence interval. We surveyed the population between August and October of 2023, and the providers were surveyed between September and November. We had more resistance, and it was much more challenging to get providers to speak with us. We had 220 completions, which was a 73% response rate, and we were surveying physicians and APPs that practice in Douglas County. For post-survey, we ended up, just so you know what work went into it, up until July. We had in April the findings review for Douglas County. We presented at the Immunization Task Force in May and Creighton University at the end of May. And then in June, we had a 3-hour Community Care Council that was hosted by Douglas County. And that was where Katie and her team really worked on workshops and unpacking the findings and talking through some strategies that the Community Care Council could work on. And we'll talk a little bit about that. Sorry, I'm not used to not doing my own slides, Heather.
Okay.
We asked for some feedback for post sessions for the Community Care Council, which was very positive as far as the effectiveness of the coach presenters, and that was all Katie led that. The quality of the content, the overall learning atmosphere, and then the overall session value. And you can see here it was out of 5, 4.8, 4.7. We'll start with going through the population survey findings. If you could go to the next slide. And this is, the next slide will be an executive summary around that. So when we looked at reported survey responses for COVID-19 specifically, 82% surveyed had received at least one dose of the original COVID-19 vaccine. And that's right on par with the US population statistics that 81.3% received a first dose. When we looked at who received the bivalent COVID-19 vaccine, it was 44.1%, which was more than double of the US population statistics when we looked at that, which was 14 to 20%. The flu vaccine specifically, 47.7% of adult households reported at least one household adult did not receive a flu vaccine in 22 to 23, and 73.8% of county residents received the flu vaccine, but not in a doctor's office. So the top three places that vaccines were received were, for influenza, was drugstore pharmacy was the first, doctor's office was the second, and work was the third. For COVID-19, you'll see that drugstore pharmacy was also the first, clinic health center was a second, and doctor's office was the third. For childhood vaccinations, 92.2% of all children that have received all the vaccinations for their age. 6.7% of parents of potential newborns would not want their child to get recommended vaccines. When asked why they had the hesitancy, a little over 50% cited safety concerns. When we looked at HPV, if one had a teenager or a young adult, 14.9% would not recommend HPV vaccine. And when we asked them about their hesitancy, they cited safety concerns that they don't trust it. And the next slide, we'll talk about influenza. When we looked at the reported survey responses, 64.3% of adults had received a flu shot during the 22-23 flu season. And the estimated US statistic is 46.9%, so a little higher than that. 77.7% of all adults were aged over 65, and 73.7% that received the flu shot were reporting long-term health conditions. 42.9% of adults with a long-term health condition live in homes with an unvaccinated member of their family. 26.2% will definitely not, or probably will not, get vaccinated in the upcoming flu season. And survey respondents that self-identified as men, very low income, non-white, report definitely not or probably not likely to get an upcoming vaccination for flu. When we looked at the number of years in the past that respondents have received a flu shot, 47.8% had received a flu shot every year for the last 5 years. And you'll see here 10% had received 4, 11.3% had received 3 flu shots within the past 5 years, 7.5 had received 2, 6.2 had received 1, and then 17.2 had never received a flu shot in the last 5 years. The main reason for not getting vaccinated that they cited was that they felt it was not needed, which was 38.8%, and then fear or distrust was 25% of the respondents. For COVID-19, when we looked at the survey responses, 82% of adults had received at least one dose of the original COVID-19 vaccination. 44% had received the bivalent vaccine. 65 plus age and those with long-term health conditions were more likely to receive the vaccination. Those with very low income were least likely to receive the vaccination. And 35.1% of residents will definitely not or will probably not get future COVID-19 vaccines, with Western Douglas County respondents much less likely to get future vaccinations. 41% of the households with children 6 months to 18 years of age report having an unvaccinated child as far as COVID-19 goes. And then the main reason for not getting the original COVID vaccine, when we looked at that group, 63.2% gave us other. And so when we dived in deeper on the comments for that, there were not enough research or testing. I don't trust it. I don't believe in vaccines. don't trust the CDC's recommendation, unsafe, don't know who or what to believe, did not think it would work, people I trust were against it, or they were scared. So 63.2% cited fear or distrust, and that's some of the comments. 20.6% said not needed, and then as far as side effects go was 8.3%. On the next slide, we talk about a little bit more about COVID-19 and the reported survey respondents. And this is the degree to which various factors impacted their decision to not get the COVID-19 vaccination. And you'll see the top three were not enough research testing, concerns about side effects, and didn't trust the CDC. Among the bivalent unvaccinated, 73% reported perceived lack of research testing. That's what impacted their decision to not get the bivalent vaccine. 71% report concerns about side effects, and 63% reported distrust with CDC. And the next slide is childhood vaccinations. When we looked at survey respondents among households with children under 18 years old, 92.2% report that all children have received all the vaccines recommended for their age. We looked at non-vaccinated, lower income was less likely to report children receiving recommended vaccines. 6.7% of Douglas County respondents with or without children at home say if they had a newborn baby, they would not want him or her to receive all of the recommended childhood vaccinations. 14.8% of adults report that their attitudes toward child vaccinations have changed as a result of the COVID-19 pandemic, with 1/4 mentioning positive changes in attitude and 3/4 citing lack of trust, safety concerns, and a perception that there's not enough research. 14.9% said if they had a teenager or young adult, they would not want him or her to receive the vaccination against HPV. And the next slide are sources of concern for childhood and HPV vaccinations. So the main reason for not wanting, and this is hypothetical newborn parents, whether or not they have newborns, to get all recommended vaccinations, 50.9% cited safety concerns, 27% cited perceived as unnecessary, and then 6.9 personal reasons, uncertain, and other. And the main reason for not wanting, and this is hypothetical whether or not they have a teen or young adult in the house to receive HPV vaccinations, 28.4% cited safety concerns, don't trust it, 22.6% perceived as unnecessary, and 17% concerned about side effects. The next slide, it really dives a little bit deeper into the sources and levels of trust regarding vaccines. And so when we looked at when we asked who they trust, family doctors are the most trusted source for vaccination information. There are some outliers that exist, and that would be populations with family doctor distrust. We looked at that, we pulled them out, and it was very low income, Southeast Douglas, Hispanic, Black, LGBTQ community was under 10%. For that, when we looked at levels of trust and potential sources of vaccination information, a great deal of trust, 66% trust their family doctor. Local health department was almost 33%, and CDC 31%. If you go to the next slide, we will talk a little bit about the provider survey. So I'm giving pretty much a high-level overview. We had deeper dives on all of this that is all recorded, and I'll direct you of where you can go for that information, because I don't want to leave any pertinent information out. When we looked at the provider survey, one of the fascinating things is for me is the provider comments. And so when you dive in you can see the providers had a lot of comments. This is just one provider survey respondent that said, I don't provide vaccines in my office, and I no longer do primary care or routine exams. However, the patients I see are at very high risk for disease that are preventable, and this survey is encouraging me to start talking about them with my patients. So we saw a lot of that and a lot of interesting comments that you can view in the portal that I'll be sharing. On the next slide, this is just an executive summary of the provider survey. When we asked providers what their main source is for information, 76% said CDC is the most trusted source of information. 87% of physicians and 73% of providers discuss upcoming scheduled vaccines as part of their process. Primary care providers are cited as most responsible for promoting and encouraging vaccination to patients. So when we ask providers, who do you think is the most responsible? They said primary care providers. Providers find the greatest benefit. So in 75% say that assistance with low and no cost vaccines for vulnerable patients is the most benefit to them. 71% said educational materials regarding efficacy, safety, and necessity of vaccines. 66.5% said up-to-date research regarding long-term effects of COVID. 63.6% said educational materials in non-English is most beneficial. The majority of physicians and providers believe the population is less willing to get vaccinated compared to last year. And providing information about vaccine clinics, offering free or low-cost vaccinations, and ensuring resources are available in multiple language are cited as the most valuable among providers. The next slide is around the COVID-19 vaccine.
Ma'am, can I ask you really, before you go back, can you go back?
Sure.
Can you explain that blue box and where it correlates to? I might have missed, I think I missed that. The material, okay.
Sure, sorry about that. So 57.5% said materials. We asked, would materials overcoming vaccine hesitancy be helpful to you? And I can give you the exact question. I can put that in the chat or email that. But would that be helpful to you? And 57.5% said that would be the least helpful thing, would be materials that would help overcome vaccine hesitancy. They said the most beneficial would be 75% said assistance with low or no cost vaccinations, educational materials regarding efficacy, safety, and necessity of vaccines, 71%, and then 66.5 said up-to-date research regarding long-term effects of COVID, 63.6 said educational materials in non-English.
So, and I don't want to stop your flow, but that's why I asked you. I'm just trying to, so it sounds like you're saying, it sounds like, at least I'm interpreting like the person would say, okay, just give me the vaccine so I can give it out at no cost. And don't worry, I mean, if I just got the vaccine and they can get it for free or low cost, there's a greater chance of them taking it than trying to even explain or overcome a hesitancy.
Well, 71% said educational materials regarding efficacy, safety, and necessity. So they cited facts. And I think when we were saying materials overcoming vaccine hesitancy, they looked at it a different way. And said 57.5% said that would be the least helpful. But I think looking at how the questions were worded is extremely helpful, so I'll make sure that's available to you.
So, yeah, and this is my last one on that because it just stuck out. So it seems like two of the same coin. It seems like just the framing. Don't ask,
exactly.
Don't tell them about hesitancy. Tell them it's safe. It's whatever. It's just the wording and the framing of the question.
Exactly.
Okay.
And there's a lot more to really unpack on the population survey that I didn't have time to get to because it's a really high level overview. But what patients are really looking for is to be listened to and to be heard. And providers are wanting to, and they want facts and they want to trust their provider. And so that's what we really focused on during the Community Care Council is how to connect the two, because there seems to be a misalignment in how providers are talking to patients and what patients are looking for.
Okay,
And
thank-
all of that is recorded in the portal, which I think is worth listening to.
Okay, thank you.
Sure. When we looked at, and again, this is talking to providers about the main reason for delaying or refusing COVID-19 vaccinations, providers believe younger and those with more conservative viewpoints are more hesitant to get vaccinated against COVID. So on the right, you'll see some of the comments. They do not see their friends and family getting as sick anymore, is what patients are saying. They're suspicious for political or social reasons. They believe it doesn't work. Most of my patients do not feel the need to get it or low benefit to risk of vaccination. So risk reward. The expert advice has changed so many times in their perception is what they're hearing from patients. And so you'll see when we look at the main reasons, 30% is other. And I think that's why the comments are really important to read through. Misinformation is 10.6, and then 10.6% is doesn't work, is what providers said that they're hearing from patients. And the next slide talks about effective influence strategies reported by the survey respondents. So 38% of providers cite that they have effective strategies to encourage COVID-19 vaccines. And when we looked by region, providers in Northwest Douglas have the lowest percentage, or feel they have the lowest percentage of effective strategies, and that was 25%. So among the providers who said that they have found effective strategies for promoting the vaccination, 21.3% said giving them facts and education. 13.1% said addressing and listening to their individual concerns. And then on the next slide, this is when we looked at the party most responsible for promoting and encouraging vaccination to patients, and we talked to the providers about who they feel is most responsible. 86.9% said physicians, 68.2% said APPs, family medicine and general practice, 79.8%. Universally, providers cite primary care providers as the most responsible for encouraging vaccinations. And then among the providers, 87.5% of physicians and 72% of APPs cite yes, discussing upcoming scheduled vaccines is a routine part of their process. When providers said no, it is not part of their process, the two top reasons were that they were not a primary care physician or they were not in hospital-based care. And the next slide is part of what Katie's team really focused on during the Community Care Council is when it comes to providers, 76.3% say that their primary source of information for vaccination comes from CDC. 21.3% focus on giving facts and information. 13.1% listen to individual concerns. And then when we talk to the population as a patient, when it comes to trusting their family provider, 32.8% have distrust in CDC. So that's the misalignment we're talking about. So if a provider is saying, here's facts from CDC, and the patient, there's 32.8% of them that really have distrust in CDC, that's the misalignment. 23.1% cited little or no trust in health department, and most concerned with trust when we looked at the patient side, most concerned with trust, safety, side effects, and what the necessity is. And then the provider, so we do a lot of research when it comes to patient experience and providers, and patients, their perception of when they have loyalty for a provider is really driven on the provider listening to them, respecting them, and their knowledge of their own medical history. So we did a lot of work on that during the Community Care Council. And the next slide talks through, the Community Care Council was 3 hours. Douglas County hosted that, and there was a large group that attended. I think it was the first Community Care Council. And the findings from both the population study and the provider study were presented, and then Katie broke everyone out into groups. And so there were 4 groups, and after the breakouts, they rejoined the main meeting and talked about what were the group activities, what was the top takeaway, and then what were their top goals. And so the first group said that in reflection, that in their own anecdotal experience, the findings really matched what they'd experienced themselves as far as mistrust and information goes. And their top goals were around how to counter the misinformation, the role of providers in being a trusted voice, so many less credible sources of information with danger and risk. So really how to counter misinformation, and not hearing from providers who are countering that information. So being able to hear more around success and how we can reclaim that space of being a credible source. When it came to group 2, they were also not surprised by the findings. It was similar to their current thinking. They were very encouraged by the participation and accuracy of the data, and their top goals were around establishing trust. And they said that they all admitted that can be a very overwhelming task, and they want to focus on education and collaboration, and they wanted to focus on groups that collaborate and work with physicians to get more education and trust out to help support their dialogue. Group 3, their top takeaway was that there's a lot of hesitancy due to the fact that HPV is sexually transmitted. They see a lot of pushback from parents thinking that it's a negative thing and not needed for their child. Their top goal is around education, more impactful messaging around the consequences tying cancer to HPV and what that looks like was one of their top goals, tailoring the message to different audiences. And then another thing that was mentioned was messaging at the clinic. So, and hospital, doctor's office. So starting at the reception desk, the messaging, and then all the touch points. So in the actual patient waiting room, in the room when they're waiting to see the physician, at the reception desk, at the checkout desk, having the messaging everywhere. So it's a consistent message throughout versus just having the provider speak to them about that. And then group 4, their top takeaway was around the results reflective of previous thinking and seeing as interaction. So again, they were not surprised. It matched what they had heard. And then their top goal was really bringing together people in the community. So they mentioned pastors, barbers, community leaders, small businesses, building trust with their assistants and getting the information out. When it came to issues with the CDC, they were talking through the fact that they don't feel CDC messages around anything to counteract that negativity. So they said the CDC's done a lot of great work that they should take credit for and message out that around what they've done in the past. And then the next slide talks through the provider findings. So we went through all the provider findings study and then broke out into groups. And this is a different 4 groups. So we just randomly put 4 groups together out of the entire group. And then when we came back into the main session, the top takeaways from group 1 for the provider findings were that there was a real lack of communication to support specialties. The top goals from that group, they felt communication is key, opening up the communication channels to those without a primary care physician. So a large group of the population don't have primary care physicians, and we know that providers feel that that information needs to come from primary care physicians. So making sure there's an open channel of communication to those that are not primary care physicians and how they communicate out around vaccinations. Word of mouth in the community, various medical institutions and health professionals were brought up, how to provide information on safety and feasibility, and then help them address hesitancy head on versus shying away from it. And I know Katie and her team do a lot of work around establishing trust from the first visit and how to speak to the patients. A lot of coaching around that. And so I know she went into that a little bit on the call. And then group two, key takeaway was helping physicians find different forms of communication and different ways to communicate with patients. And they talked about how controversial all the vaccinations are today, and something that's not something we saw pre-COVID is what group two felt. And then top goals for that group were around just really figuring out how to have a stronger partnership between groups, between everyone as far as community agencies go, providers, peer groups, peer resources, how to equip for interpersonal communications. And then they talked about really being able to, how do we educate peer groups and teens? One idea that came from that group was having ambassadors, and this is younger groups that are looking to study health in college, teens in high school, having them be ambassadors of health and helping with that. And then peer groups just, coaching them on how to talk about vaccinations. Group three, their top takeaway was around community and education and how to be creative when getting the messages out. Some of their top goals and ideas were around, radio, dances, and this is, through schools, music, parades, how to reach the younger populations is what they were talking through. One of their members, I listened to this last night again, just as a refresher, said he was from industry. He said that he could help, and that industry has several ways, unbranded information, stickers, pens, that they would be willing to distribute, to different groups. And so that was one of the solutions from group three. Group four said that they all agree on the communication portion. And the key takeaway was, not leaving physicians without support, and really building team and community work. And so their top goal was community health workers educating the population in different languages. So making sure that we're linguistically and culturally appropriate when it comes to how we educate the community, staffing peer educators and making sure that, they're educating. Strategies on communication is something that Katie's team really dove into during the Community Care Council. And then just really touching on the role of the community health workers and how their role is crucial, that the responsibility is not all on the physicians, but also on the broader clinic, and what can the clinic do to assign outreach and other educational tasks to communities and patients. And the next slide shows where we are housing all this information. So we have the provider survey results and the population survey results. We have every recording from, including the Community Care Council, which was 3 hours, all posted on this portal. And I can put this in the chat for everyone. And I'm sure Douglas County can send this out also via email. But it's a URL and there's a password to get in, which is DCHDVax. And you can download the presentations from there. If the questions, I'm not sure if the comments are on there, but those can be made available via request to Douglas County Health Department. And then the next slide is just contact information for both myself and Katie, who does Katie's team, Healthcare Experience Foundation. They do a lot of work with healthcare physicians, on-site frontline leaders, clinics, staff on how to educate the community. And I put my phone number in here. I didn't list Katie's, but I'm sure she'd be happy for me to send it out if anyone's interested. I don't know if we have time for questions because it looks like we're a little past 10 o'clock, but any questions that you have, if you have any additional questions, could be emailed or sent to Douglas County Health Department as well.
Questions?
I just had one question. On the provider survey, do we see a breakdown of that? Like how many were primary care providers versus administrators? Or, I mean, I just kind of the comments, it kind of seemed like everyone's saying, well, that's the primary care provider's job. Is that broken down or no?
Yes, we did. So that's not on these slides. This slide, I believe, if you go to maybe slide 3 or 4, Heather, where it shows the methodology, we looked at APPs versus provider physicians. I think it's the slide, next slide. Yeah, this one. So this one shows that there were 176 physicians and 44 APPs. But as far as specifics around that, that would be in the broader research that we have. As far as specialty goes, how many were primary care physicians from here? We do have that recorded, though.
They can get it to you. Yeah, I'd like to see that. Okay, you got a request for it, so. Anybody else?
Okay.
All right. Thank you.
Thank you.
Item 5, Health Director, let's report.
Good morning, and I promise to be brief. Just a couple of updates for the department. I wanted to formally announce that we have offered the environmental health chief position to a candidate, and that has been accepted. So we are very excited. We are going to have our new chief incoming. Tentative start date at this point is September 3rd. His name is Eric Bradley. He'll be coming from Cedar Rapids, Iowa, where he is currently in a role very similar to what our deputy director currently is in. So he is the deputy director there, also oversees environmental health specifically for that health department. So he's going to be coming to us to take over our environmental health. He has about 26 years of experience in various different areas of environmental health, including quite a bit in food safety and compliance, sanitation, air quality, and also emergency response. So we're really excited to see him bring that his skills there to Douglas County. And he did have some pretty great references, including the executive director of the National Environmental Health Association. So we will look forward to seeing him, and when he is here and situated, I will make sure that we bring him in and get you an introduction to our new chief. Another update on accreditation. So as you know, we were able to submit all of our accreditation paperwork some months ago. On July 2nd, we got our pre-visit review back from FAB. So the pre-visit review is basically a, hey, we went through all of your documents. Here's where we have questions, and we'd like to see some corrections or some additional information. So we're currently working on that list, and that is due by August 15th, so we don't have long. They give you about 45 days to pull all of that. Happily, we have a very talented accreditation coordinator who pretty much the day after we got that notification was already in contact with our domain leads for each of the domain teams, and working on a strategy to get all of those items taken care of. So I will keep you updated as we go. So the next step after this, after we have submitted kind of our extra information to them, then we will sit and wait to hear when they're going to be coming to do their actual site visit. So we will definitely let you know when that's happening, as some of you may be involved. It's likely that they'll want to talk to the Board of Health or at least part of the Board of Health as part of that site visit process. And then my last item for today, we were able this month to launch our Vision to Reality work, which you heard a little bit about earlier on, and just really excited about this particular work. And I am actually going to possibly get just this, it's a nice one-page overview of kind of our foundation and where we plan to go from here. Okay. Excellent. Okay, so we're calling this vision to reality because we want to make sure that we know that we're not just sitting around and having great ideas and then not doing anything with them. We really want to make sure that we are operationalizing these ideas that we have and the core values that we have. So this is really going to be our foundation as we move into strategic planning, which will be happening this fall, which you'll be part of. But here is what we've come up with, and this process started at the management level and really kind of talking about who are we, who do we want to be, where do we want to go. We then were able to engage our staff in this conversation. We identified some champions around the health department to help us kind of hone in on some of these items, and then we were able to roll it out to the entire department to first of all let them know kind of what our big ideas are, and then also get their feedback on what's the best way to make this happen. And some of that we're still working on, and that will be something that we talk about kind of over the next 6 months or so. So our purpose is defined as working together for the health and well-being of everyone everywhere, which I think aligns pretty darn well with our mission and our vision. You see something called a BHAG, and that is a big, hairy, audacious goal. So we really wanted to set kind of a stretch goal that people could get excited about, maybe be a little bit scared of, to really give us something incredible to shoot for. And we figured we might as well go big or go home. So our big, hairy, audacious goal is by 2040, that's 16 years from now, we will be the healthiest metro county in the Midwest. And next month, I will be very happy to spend a couple of minutes telling you how we're going to identify really the measures that we will use to measure that and say we are in fact the healthiest metro county in the Midwest. So that is what we are shooting for. I think it's an amazing goal. And I also am 100% confident in our department's ability to get there. We also looked at our core values and kind of reframed those a bit. These are the 4 that we came up with that we're all rallying behind and are kind of setting our foundation for our future work. So people first, Douglas County Health Department embodies people first values and is focused on our community's resilience and quality of life. I think that's pretty much a no-brainer for a health department to be focused on the people that we serve. Belonging is our second core value. We want to make sure that Douglas County Health Department is an environment where our community is welcomed and accepted, and our teams and our partners reflect the diversity of the community we serve. Innovative excellence is very important to us. We want to make sure that our creativity and our collaboration set the standard for public health excellence in our operations and outcomes. So we're not always just doing things the way we're doing them because that's how we've always done it. We're always looking for what is the best, what best practices have evolved. If we are trying new and innovative things, also communicating the outcomes of our new, doing something a different way and making sure that other public health entities around the country are able to benefit from the work that we're doing as well. And I would say one of the most important core values that Douglas County Health Department will have as a foundation is integrity. So our unwavering dedication to things like evidence-based practice, high ethical standards, and really understanding our community's voice will build a foundation of trust for all. So we want to make sure that we're listening well and taking into account our community's voice and that we're doing what we say we're going to do and following through to take care of our community. So those are the core values that we have settled on, if you will. And again, we are still doing quite a bit of work, a little bit each month over the next 6 months to really solidify these and help all of our staff make a connection between their individual work and how that really marries up to these core values and to this goal. So more to come on this, but we're so excited about this work and how far we've come in it. We wanted to make sure that you as the Board of Health got to see, kind of the foundation that we're setting. And I think it's going to be great as we move into that strategic planning and we start setting some of those more concrete goals. And that is all I have for you today. And I'm sorry if I talked really fast. I know we're over time. All right, thank you.
The reports. Okay, saying none. There's no need for executive session. Is there a motion to adjourn? Motion by Weiss, is there a second? Second by Wade, roll call.
Wade,
Yes.
McNally,
Yes.
Festerson.
Yes.
Jones, Rogers,
Yes.
Wilkin. Yes. Weeks. Yes.
But Leah and Justin, I got some questions though. They don't